Welcome back! Today we're discussing a critical topic in cardiology: managing heart attacks complicated by cardiogenic shock. Specifically, we'll look at the CULPRIT-SHOCK trial, which compared two approaches to percutaneous coronary intervention, or PCI, in patients with multivessel coronary artery disease. Should we focus on the most critical blockage, known as culprit-only PCI, or is it better to treat all significant blockages, known as complete revascularization? Let's dive into the results and see what works best. Cardiogenic shock during an acute myocardial infarction, or MI, is a critical condition where the heart can't pump enough blood, often due to severe blockages in multiple coronary arteries. The optimal strategy for revascularization, treating just the culprit lesion or all significant blockages, has been debated, especially in unstable patients. Understanding the best approach is crucial for improving survival rates and reducing complications in these high-risk patients. The CULPRIT-SHOCK trial included 706 patients with acute MI and cardiogenic shock. Participants were randomized to either culprit-only PCI or immediate multivessel PCI. The primary outcome was the composite of death from any cause or severe renal failure requiring dialysis at 30 days. This trial aimed to provide clear evidence on which strategy offers better outcomes for these critically ill patients. The primary outcome showed that the culprit-only group had a significantly lower rate of the composite outcome, at 45.9%, compared to the multivessel PCI group, which was at 55.4%. There was also a notable reduction in all-cause mortality with culprit-only PCI, at 43.3% versus 51.6%. Additionally, 21.5% of patients in the culprit-only group required staged or urgent repeat revascularization, highlighting the need for follow-up interventions in some cases. The findings support a strategy of focusing on the culprit lesion during the initial intervention, with the option of staged revascularization for remaining blockages. This approach may be safer, minimizing the risks associated with longer procedures and higher contrast use. These results could influence future guidelines, encouraging a more conservative initial approach in managing patients with multivessel coronary artery disease and cardiogenic shock. The trial was a multi-center, open-label, randomized study conducted across 83 centers in Europe. It included patients with multivessel coronary artery disease and cardiogenic shock, with a follow-up period of 30 days. This extensive and diverse patient population helps ensure that the findings are robust and applicable to a wide range of clinical settings. The primary outcome focused on mortality and the need for dialysis. Secondary outcomes included recurrent MI, repeat revascularization, and bleeding complications. These comprehensive outcomes provide a clear picture of the benefits and risks associated with each revascularization strategy. The CULPRIT-SHOCK trial provides strong evidence favoring a culprit lesion-only PCI strategy in managing acute MI with cardiogenic shock, especially for patients with multivessel disease. This approach appears to reduce short-term mortality and the need for dialysis. However, further research is needed to understand the long-term outcomes and the role of staged interventions. Thank you for watching. If you found this video helpful, please like, subscribe, and hit the notification bell for more updates on the latest in cardiology and critical care. Stay informed and stay healthy.